Welcome back to the Pulse. Let's get down to COVID-19. Did you know that between the year 20... All right, so we'll talk about COVID-19 because there's a new variant, the Omicron variant, and the Ghana Health Service is descending heavily on vaccination and asking people to do that, because if you don't, you won't be able to visit the places that you love to go this December. We'll be talking to the Ghana Health Service more on how this will happen and how they intend to enforce this. Dr. DaCosta will be speaking to me as Ghana tries to revamp and ask a lot of people to vaccinate. And remember, we have a target of 20 million of Ghanaians who are supposed to be vaccinated. Now, we're looking at this new restrictions, and Dr. ABOAGYE is the director of the Ghana Health Service. Listen to him.
These are the proposed mandates which we are going to pursue. With the increasing availability of vaccines and reasonable quantity in the pipeline, we are declaring December as the month for vaccination, or let's say vaccination for Christmas. So December is going to be declared as the month of vaccination, and it will be launched by the Honorable Minister on 30th of November 2021. That's Tuesday coming. These mandates, which I'm going to announce, will be applicable in January 2023 at specific groups and manners as soon as, and this mandate become effective as soon as the campaign is over. We have them in two sections. They are going to have proposed groups that will be covered under the mandate and the venues. We are looking at all the three arms of government. All health workers have been given the opportunity to vaccinate, and they stay in a very strategic position that either they can share among themselves or give to their patients. So that's why we prioritize that. And remember, we are talking about these are the people who have been prioritized at the beginning, even when we had very few vaccines. And so we expect that. All security personnel will be covered. They should be vaccinated. All staff and students in secondary and tertiary schools should be vaccinated. And so secondary schools are being given the opportunity. Started last week, Friday, from 27th, almost all regions are doing vaccination of Pfizer in schools. And so in January, you should be fully vaccinated before you come back to school. All workers in government institutions and parastatals, all commercial drivers and their mates are expected to be vaccinated at the end of that. That's where they're commanded to cover them. There are areas where the mandate to cover, that will be a venue. And this venue for now includes nightclubs, beaches, sports stadium, and restaurants for indoor dining. And these are areas that will mean that you need to be vaccinated before you can go into these venues, and that will be enforced.
He said proof of vaccination would also be needed for nightclubs, beaches, sports stadiums, and restaurants. Only 21% of the targeted population have received the first dose, while 7% are fully vaccinated. Health Ministry data showed Ghana has to date recorded 131,083 coronavirus cases and 1,220 deaths. ABOAGYE said the Health Ministry hopes to double daily vaccinations from over 142,000 currently as the country braces for a potential surge in cases after the holiday. This afternoon, we have a conversation with leader of the COVID-19 risk communication team in Ghana, Dr. ABOAGYE DACOSTA, who's also director of health promotion at the Ghana Health Service. Dr. DaCosta, I'm grateful for your time this afternoon. Hello, Dr. DaCosta. Kindly unmute for me so we can have a conversation.
Good afternoon.
Great. So I need you to tell us about the mandatory vaccination. What exactly, what does it mean? How much vaccine is available?
Okay, thank you very much. Let me say good afternoon to all Ghanaians as well. I think as a country, since we started the pandemic, we've done a lot. And in the midst of vaccine scarcity, supply chain challenges, I must say that the government and the president, through many efforts, have been able to brought in country about 12.3 million of the vaccines. Just last week, we received about 4 million. Now, we from the ministry and the Ghana Health Service believe that the exercise is going on well, but it's also time for us to encourage Ghanaians to obviously take the vaccines that we have, because we are all not safe until we are all vaccinated. Now that we have enough vaccines for many people, we are starting the second phase where we are rolling out to the general population. So within the service, what we are doing is we are working through our decentralized system where our regional health directorates and the district health directorates do have the vaccines now. Now, they have set up centers within all our health facilities. But what we are also doing is we are chasing people with the vaccines. So, for example, in churches, we are giving to people who attend churches, sports stadiums. We are giving to people in various locations. So, we believe that it is time for us to alert Ghanaians that within the month of December, at least 4 weeks window, everyone should be vaccinated. Now, I talked about our target is to bring in about 20 million by the close of the year. We have brought in about 12.3 million. I know that there are about 7.4 and additional doses in the pipeline. So I can round it up to about 8-point-something million in the pipeline. So we believe that we'll be able to get that 20 million doses in country by December, by the end of December. Now we need the cooperation of the Ghanaian people. This is why we are declaring the month of December as the vaccination month, to offer everyone opportunity to vaccinate. Now, when this campaign ends, then people wouldn't be able to go to certain places have they not been vaccinated, or they may have to show PCR tests before they are able to go to those places. And we've started serious engagements. The health minister on Wednesday, in fact, the director general said Tuesday, but it will be on Wednesday. We will obviously launch this vaccination month to re-emphasize what we said at the press conference, and also to make it clear which groups are going to be affected. Bear in mind, initially, when we started this vaccination, we gave priority to some groups like health workers, the elderly, the security officials, the executive, all the three arms of government. So we believe that in setting up this mandate, we are proposing that certain groups will have to show vaccination certificate before they enter certain venues like workplaces, sports stadia, restaurants, and beaches. So this is the exercise that we'll continue to do until it kicks in, the mandates kicks in January. But I must say that we'll do this within the legal framework of Ghana by using, obviously, the president still chairs the COVID task force. So consultations are ongoing in what's supposed to be in place before the 4 weeks window.
Dr. DaCosta, I'm curious to know how you intend to actually enforce these new restrictions, especially with the difficulties we've had with similar restrictions in the first, second, third waves of the COVID-19. In this particular one, I find nurses, I find policemen. One of the questions they will ask you is, If a policeman refuses to vaccinate, I mean, who checks the policeman? I mean, how is the collaboration like?
Okay, thank you. So let me say that the security forces, their heads are part of the COVID-19 task force, and we decide with them. And in the enforcement of these restrictions, the police, the security agencies are going to play active role in this. Heads of institutions are also going to play active role in this. For example, if we are saying that for, I'm using the health sector as an example, we are saying that for our health workers, if you are not vaccinated, you cannot come to work. Yes, you have obviously heads of the various institutions from the region to the district to the health facilities, and we will be checking this. Now, let me say that by technology, it's easy to verify because the certificates do have QR code. So all you have to do is for the person checking to scan, and it will scan the QR code. It will lead you to our website, and all your information, everything will be available for us to know if you're vaccinated or not. In the absence of that, then you may have to show a PCR test before you are allowed to the workplace. So we'll be working with, for example, the Public Services Commission. That's why I said that all legal means within the framework will be considered so that people's rights are also respected.
All right, so we'll be getting reactions, especially from drivers, and the GPRTU will be joining us for this conversation shortly. But I also need to also find out from you, the people who fail to take advantage of this period, what happens to them?
We'll still, the exercise will still be ongoing from January. So you will be refusing entry into such places. So that's why it will be no vaccination, no entry. Then we'll direct you to where you can get your vaccination, to go and vaccinate before you come for the intended program that you want to attend.
Share with me your execution plan, Dr. DaCosta.
Yes, so this is why we've given 4 weeks windows. Like I said, the consultations are still ongoing. We really want to make sure that we get this right. So we are engaging, for example, we'll be engaging the traditional leaders, commercial drivers, health workers union. A lot of stakeholder engagement programs have actually occurred, but some will still be ongoing. We will make sure that we obviously consult broadly before the enforcement of this by the 1st of January or by the end of this exercise. And it is the reason why we have given 4 weeks window. Because bear in mind, I said in my earlier submission that we've given such people, for example, priority to vaccinate, like the executive, all the 3 arms of government, all the health workers, all security personnel. There wouldn't be any excuse for not vaccinating. And we are also providing alternative. For example, without your vaccination, you must show proof of the test that you've done for us to keep, for in the health sector, for us to keep yourself safe, keep our patients safe, and keep the staff safe as well.
For Dr. ABOAGYE DACOSTA, he's Director of Health Promotions at the Ghana Health Service. This is something we'll be monitoring and see how successful, especially considering how, the last few similar restrictions went throughout the COVID-19 pandemic.